Good morning, my lovely nurses. I hope you are fine and your family is good. So, this week our topic is dosage calculation. Yesterday I discussed two methods how to do the dosage calculation. Today is our third method, how to calculate the rate of the infusion. So, our topic is dosage calculation part 2. So our today method is how we will calculate the rate of the infusion. So the method is same that yesterday we discussed, desired dose divided by hand multiply by vehicle. Same formula we will use. The finding the desire actually just a bit more work for this one, how to take the rate, how to calculate the rate of the infusion. So our final answer always should be always the ml per hour. We always in this method, when you will see the question, they will ask you how many ml per hour we will give the infusion or start the infusion of the patient. That is how our IV pumps mean, what infusion rate we will fix for the patient ml per hour. In the question they will ask you how many ml per hour. So we will discuss the step 1 to how to take the desired rate of ml per hour. Our step 1 is find the desired dose. Always ml multiply kg and multiply 60. Why I put 60? 60, the 1 hour have 60 minutes. So that's why we will multiply with the 60. Step 2 is desire divided by hand multiply by vehicle. So same formula at the end we will use, but before using this formula we will multiply ml multiply kg multiply by 60. As I told you, always we will take the kg, not the lb. We will always convert lb into the kg. And one more thing keep in your mind, if the order is in minutes, if in the question they will tell you minutes, they will not tell you hour. If they will tell you minutes, you must multiply by 60. So this is very important, always multiply by 60 to convert to the hours. So we will take one question, the practice question, so you will understand more the method of the rate. So I will write there one question. So while working in the ICU, you are checking the drip. You are checking the drip rates of your vasoactive infusion. Your client is ordered to have norepinephrine running at 0.4 microgram per kg per minute. This is the infusion rate ongoing. Their weight is 26 kg. The concentration of the norepinephrine is 20 microgram to 1 ml. What rate should the pump be set to? So question is, while working in the ICU, you are checking the drip rates of your vasoactive infusion. Your client is ordered to have norepinephrine running at 0.4 microgram per kg per minute. Their weight is 26 kg. The concentration of the norepinephrine is 20 microgram to 1 ml. What rate should the pump be set to? Desire is 0.4 microgram. In your hand you have 20 microgram to 1 ml. Now what we will do first? So as I told you before, our step 1 should be, first we will do ml multiply kg multiply 60. They write there minute. 0.4 microgram per kg per minute. So first we will take the desired dose. First we will found the desired dose, then we will use the formula. So in the ml, what's the dose is in per minute? 0.4 microgram multiply what's the kg weight? 26 kg multiply by 60. If we will calculate this one, 0.4 multiply 26 multiply 60, our answer will come here 624 microgram per hour. 0.4 multiply 26, because always we will because the patient weight is 26 kg and we will give 0.4 microgram per kg, so always the weight multiply with the desired dose that doctor ordered, give 0.4 microgram per kg. So per kg is 0.4 microgram, but we will multiply with the 26. So with the 26 0.4, and then we will also take 60 because they write there per minute. We want the dose per hour. So multiply 60. So our desired dose came 624 microgram per hour. Now we want to implement there our formula. So our formula is that I told, desire divided by hand multiply by vehicle. So our desired dose is 624 microgram. As I told you, this is our desired dose, multiply what is in our hand? 20 microgram. Sorry, this is divided. 20 microgram multiply 1 ml. How much we have? 20 microgram to 1 ml. Vehicle is 1 ml. So when you will divide 624 microgram divided 20 microgram multiply 1, our answer will come 31.2 ml. 31.2 ml per hour. So the pump should be set to 31.2 ml per hour. Then this is our desired rate. We will do one more practice question. So our second question is, you are titrating a nipiride drip on a hypertensive client in the CVICU. They are currently on a drip of 10 milligram nipiride per hour. Currently patient is taking 10 milligram nipiride per hour, but we want to titrate. Your most recent BP, the patient most recent BP is 102/78. The order states, the doctor states to titrate nipiride by 5 milligram per hour for goal systolic BP of 110 to 140. So how much we will titrate? 5 milligram per hour for goal systolic BP of 110 to 140. The bag of nipiride has a concentration of 20 milligram per 200 ml. So that the bag you receive from the pharmacy is the concentration of 20 milligram per 200 ml. When verifying your new drip rate, how many ml per hour should your nipiride drip be running at? So question is, you are titrating a nipiride drip on a hypertensive client in CVICU. They are currently on a drip of 10 milligram nipiride per hour. Recently patient is on a drip of 10 milligram nipiride per hour. Your most recent blood pressure is 102/78, but the doctor goal is 110 to 140 the systolic blood pressure, but the patient's systolic blood pressure here is 102. So the order states to titrate nipiride by 5 milligram per hour. Before patient is taking 10 milligram per hour, but now the doctor order to titrate nipiride by 5 milligram per hour for goal systolic BP is 110 to 140. The bag that the nurse receive of nipiride, the concentration is 20 milligram per 200 ml. When verifying your new drip rate, how many ml per hour should your nipiride drip be running at? So here also we will use the same formula. So what is our formula that we are using? Desire divided by hand multiplied by vehicle. So what is our desired dose? First we will discuss that desired amount of medication is what doctor told to titrate? 5 milligram. So desired dose is 5 milligram. And what is in our hand? In our hand is 20 milligram. What is our vehicle? Vehicle is 200 ml. Desired dose is 5 milligram that doctor informed us to titrate. Hand, what drip the nurse received from the pharmacy? 20 milligram per vehicle is 200 ml. Now what we will do? Here we will do 5 milligram divided by 20 milligram multiply 200 ml. So once you will do this one, the 5 milligram divided 20 milligram multiply 200 ml, our answer will come equal 50 ml. So 50 ml per hour of nipiride the nurse should have to titrate. Here you will think why I did not write 60, because here they mention per hour. They not mention the minutes. So that's why I did not use the 60 word. So 5 milligram divided 20 milligram desired have vehicle. So our answer is 50 ml per hour of nipiride. We will do one more practice question. So one more practice question is, while working in ICU, you are initiating a phenylephrine drip. The primary healthcare provider ordered 2 units per kg per hour. While working in the ICU, you are initiating a phenylephrine drip. The primary healthcare provider ordered 2 units per kg per hour. The weight of the patient. The weight is 75 kg. The concentration of phenylephrine is 20 units to 1 ml. What rate should the pump be set to? So the same formula we will use here. The question, while working in ICU, you are initiating phenylephrine drip. The primary healthcare provider ordered 2 units per kg per hour. The weight is 75 kg. The concentration of phenylephrine is 20 units to 1 ml. What rate should the pump to set to? So what is our desired dose? Our desired dose is 2 units per kg per hour. 2 units per kg per hour. This is our desired dose. Now, the first question, you remember, the question is same but there is a minutes. So what we did 2 the desired multiply kg multiply 60. But here we will not multiply with the 60 because they mention here hour. No, they did not mention their minutes. Whenever minutes is there, you have to multiply with the 60 to convert into the hour. So desired is 2. So first what we will do, that because first we will found the desired dose. So they write there 2 unit per kg, but the patient weight is 75 kg. So 2 multiply by 75, that is 150 units per hour. So this is our desired dose. Now what is desired dose? 150. Now what we have in our hand? So in our hand is 20 units. 20 units per 1 ml. So now what we will do, desired divided by hand multiply by vehicle. So desired is 150 divided 20 multiply 1. Desired is 150, hand 20 units, vehicle 1 ml. So our answer is 7.5 ml per hour. So that they receive 150 units milligram per hour of phenylephrine. Okay. This is our right answer. Now we will discuss one different question. So how it is different, you can see the next step. So first I will write the question. Is a practice question, but this is little different from the others. The same formula we will use, but there is little difference. So while working in the ICU, in the ICU, you are titrating a milrinone drip. The primary healthcare provider orders for the drip to be increased to 0.5 microgram per kg per minute. Here is not hour, huh? Their weight is 27 kg. The concentration of milrinone is 0.5 milligram to 1 ml. What rate should the pump be set to? Now what is difference there? First we will talk the difference that we already did before, the per minute. First of all, they tell there per minute. Number two, what is different? The concentration is in milligram, not in microgram, but our desired dose is in microgram. So first of all, our desired dose we will mention there. Our desired dose is 0.5 microgram per kg per minute. Weight is 27 kg. So 0.5 microgram per kg, but we will multiply 0.5 to with the weight 27 kg. But in this problem, they gave you an order in minutes. So what we will do? So you need to multiply by 60 to convert to hours. So how we will do take the desired dose? We will take 0.5 microgram, that is our desired dose here, multiply by kg. Kg is 27 kg. Multiply with the 60 because they give you the range in minutes. So what answer will come here? Answer will come here 810 microgram per hour. This one we take the dose in hour. So we multiply with 60 to convert in the hours. Now our next step. This is our now desired dose 810 microgram. Now next step, what we have in our hand? In our hand we have 0.5 milligram. So for the milligram, always keep in your mind, because this is different unit. Milligram. They ask you the dose in microgram. So milligram is a different unit. So what we will do? We will convert this milligram to microgram. So how we will convert? 0.5 milligram multiply by 1000. In my first lecture I give you the conversion table. So milligram to microgram we are multiply, microgram to milligram we are dividing. So this is milligram dose, we want to convert in microgram, so we will multiply. So 0.5 milligram multiply 1000 is 500 microgram. So what is our vehicle? The third step is vehicle. So vehicle is 1 ml. Because they told you 0.5 milligram to 1 ml, that is our vehicle. Now how we will take the answer? So our answer is desired dose 810 microgram divided into 500 microgram that we have in our hand, multiply by vehicle 1. This is our desired dose. This is what we have in our hand and multiply by vehicle. Desire divided hand multiply vehicle. So what our answer will come here? 1.62 ml per hour. This is our correct answer. So what is the different here? If you have different unit in the answer related to desired dose, so we will convert first our units related to the to take the desired our answers. So we convert milligram to microgram, and what the difference here? They give you in the minutes, so we have to multiply with 60 to convert into the hours. So our answer is 1.62 ml per hour. I hope you like the lecture. If you like, please share and subscribe my YouTube channel, and don't forget to push the icon bell button so you can receive my coming videos notification. So tomorrow we will do the part 3, the other method of the drugs calculations. Take care yourself and your family. Keep me in your prayers. Allah Hafiz.